Welcome back and many thanks for staying with us right here on the #1 breakfast show in the country, Morning at NTV. My name is Romeo Busiku. COVID-19 cases are rising within this jurisdiction exponentially. Now we are talking about 73,401 cases of COVID-19 right here in Uganda. 714 people have actually succumbed to the novel coronavirus disease. That is how bad the situation is within our country. Even health workers are dying. Now, if you're leaving your home without wearing a face mask, you're doing a big disservice to the people you left back home, because as you veer into the city center while walking, you're going to contract the virus and then take it back home. So the biggest or quickest or cheapest way you can actually protect yourself is by ensuring that you buy a face mask. If you fall ill, can you afford 800,000 Uganda shillings to actually get oxygen? An oxygen tank, and you only need 2 in a day, so that is 1.6 million Uganda shillings. The cheapest option is strict adherence to the SOPs. Now, we also do know that the 2021 budget bundled health and other social services, including education, social development, into one category called human capital development, and it got a whopping 7.58 trillion Uganda shillings. We do know that 1.5 trillion Uganda shillings went to the Ministry of Health, of which 560 billion shillings will be used to procure vaccines within this jurisdiction of ours. We also do know that some 526 billion shillings will be going to education, and some 124 will be going to the Ministry of Gender, Labour and Social Development. Breaking it down has been very, very hard, we shall be honest, and to speak to us about this and more, we have Mr. Peter Echweru. He is a program specialist in charge of health and human rights advocacy at the Center for Human Rights, Center for Health, Human Rights and Development. We also do have Emmanuel Kashaija, a program officer. He is tasked with gender and economic justice at the Forum for Women in Justice, better known as FOWODE. Gentlemen, a very good morning and thank you for joining us on Morning at NTV.
Good morning.
Let me start with you, Mr. Peter Echweru. Talk to us about how the budget performed in your eyes as a health activist.
Thank you very much, Romeo. The budget question is a complex question.
Indeed.
It has been a discussion we've had for so long. And unfortunately, we don't seem to see progress in terms of allocation of resources to health. It continues to suffer. Remember, this year is a unique year because of the COVID pandemic. And so we would expect to see increase in the health sector budget. Unfortunately, that is not exactly what is happening. We are seeing, under normal circumstances, a reduction. What has slightly pushed up the health sector budget, where you see it now, is the about 500 billion that was allocated for COVID. But if you remove that money, you'll really notice that we have had a reduction in the budget. And yet we've made commitments internationally, locally, that we will prioritize health, increase the budget progressively, so that we move towards the Abuja declaration of about 15%. Because it is at that 15% that as a country you're able to think about universal health coverage, where everybody can go to a public health facility and be able to access medicine and get attention from health workers. But as it stands now, the situation is dire, especially for the women, for the young people who go to these health facilities. You know very well that women a lot of times do not have the resources to cater for the increased costs of medical care. And so they are left out of this health, the health service delivery system. If you remember very well, recently, the Constitutional Court passed a decision and said that the government must prioritize health and must provide resources for this. Unfortunately, the government has done the opposite. We've not made any step in prioritizing maternal health. We've not made any steps in enhancing support general to the health sector. And so it is really so bad. If you look, for example, at health center tools, Romeo, you notice that I have to receive 100 shillings for a quarter. That's three months to run a health center too for 3 months. That is really miserable. So if you divide that, for example, into the 3 months, that means for every month, you're spending about 170,000 as a health center too. So that shows how bad the situation is. If you look at the medicines that we need, for example, while the Ministry of Health has received additional resources of about 200 billion make it 600 billion to procure medicines this year. The needs for national medical stores alone is about 1 trillion, over 1 trillion, about 1.1 trillion shillings. If you need to procure drugs, that is enough for this country. So that shows you that we are operating at less than 50% overall in terms of medicines. If you look at blood supply, for example, Uganda Blood Transfusion Service is running on a huge shortage. They are not able to collect the blood that they need. They are not able to process the blood that they need and distribute it across the country. You know that absence of blood in this country is the leading cause of maternal death. About 43% of mothers who die in this country die because of blood loss. And so that makes it important for the government to ensure that resources are actually channeled towards. Yes.
Mr. Echwere, we do know that 560 billion has been put aside for the procurement of vaccines. We've also vaccinated some 821,000 plus people when it comes to COVID-19 vaccinations. And the government has a target of 21.9 million vaccinations on the adults. Do you think that money will go a long way in procuring enough vaccines to inoculate 21 million people?
Of course, in terms of vaccines, we do not have capacity as a country to procure adequate vaccines for everyone in this country. We are going to rely a lot on the magnanimity of other countries to support this country. The French embassy has just supported us with a few. But it is evident that as a country, we do not have capacity unless we are able to to get additional resources from elsewhere. We are going to face a challenge in terms of vaccination. Even when the desire for vaccines go up, we will not be able to have enough vaccines to cover this country in a short term. It will have to be a long-term program, but with support from the international community.
All right, that is Peter Echwere, a program specialist in charge of health and human rights advocacy at the Center for Health, Human Rights and Development. We also have Mr. Emmanuel Kashaija. He is a programs officer, yes, in charge of gender and economic justice at the Forum for Women in Democracy. Welcome and thank you for joining us once again, Mr. Emmanuel. We'd like to talk to you about the fact that the budget, whether or not it is big on social development, at least on paper, what is missing? We do know that the budget is big on social development, at least on paper. Some 146 billion has been set aside for the Ministry of Gender, Labour and Social Development. But it's huge on paper. But what is missing, Emmanuel?
Good morning, Romeo. I think as Mr. Echwere has said, this year's budget, first of all, was passed in May. I am not sure that the people who passed the budget in May had anticipated this second wave to be as severe as it was.
They did not.
But for us and at Forum for Women in Democracy, we are mostly concerned about the issues of women and gender equality. And as we saw in the first phase of COVID-19, or the first phase of COVID-19, there are some issues which come with lockdowns that are not necessarily health issues, but are human rights issues. And one key issue as we are concerned about as forward is the issue of gender-based violence and how the government has been putting very top priority to the issues of gender-based violence. Romeo, we have been seeing reports in the newspapers of recent of, I think, how many girls, 1,800 girls in Toro district alone defiled and impregnated in just 3 months. If you read the police crime report for the year 2020, I think we saw how much the COVID situation of locking people in their homes and in their localities pushed up the cases of defilement all over the country. Up to 14,000 girls were defiled.
Yes.
Now, this kind of behavior comes from a systematic underfunding of the system, meant first of all to prevent this, but also the system meant to bring justice to women and girls who have been defiled or raped in the villages. Romeo, over the past 5 financial years, although we are saying the Ministry of Gender has now received money, actually the community the community preparation and mindset change program, which most of this belongs to, has a vote for local governments. That vote for local governments has not increased a bit in the last 5 years at all. It has remained at 7.6 billion. That 7.6 billion is shared across almost 176 local governments, because it includes all local governments and also includes town councils, town councils, sub-counties, and all local governments. Now, when you divide that money, and then when the money gets there, that 7.6 billion gets to local governments, it is shared by so many sub-departments. It is shared among the youth councils, women councils, disability councils, older persons councils, probation and welfare departments. All those, so many people share that money. So in the end, you find that a probation officer in a district who's supposed to monitor cases of child abuse, those cases of violence, only has 500,000 shillings a year to do his work or her work. Remember, what can 500,000 shillings do in a district in a year? It can't do much. So you find these cases go uninvestigated. These cases go, in the end, go unpunished, and in the end, we end up with escalating numbers.
Indeed, Emmanuel. Emmanuel, we are in a lockdown and everyone is wondering and giving our questions, wondering how government will be able to ascertain who is vulnerable and who is not. Now, give us a suggestion. How do you suggest government should handle this?
I beg your pardon?
We are in a pandemic, we are in a lockdown now, and everyone is asking questions pertaining to how a government will be able to ascertain who is vulnerable and who is not. Help us, give us suggestions on how they can handle that as government.
Yes, of course. I think for a long time we have been advocating that government funds its information management systems and puts to better use its structures. In Uganda right now, the LC1 chairpersons, especially in urban areas, I think that task will be, in rural areas, it's going to be a bit easier, because the LC1 chairpersons know their citizens, but in urban areas it's quite difficult. But one thing, as a gender expert, one thing I would urge the government to do is look out, calling the councils. Councillors know their people, and they need to look out for, especially when they are considering a family as a unit. They need to know sometimes that money which is given to the head of the family, who's a man, may sometimes not trickle down to the family. And so they may need to register either both the gentleman and the woman in the family, and either give them half the money, or, if possible, give the money to the woman, because as we are aware, is that in Uganda, the women bear the burden of looking after families. Sometimes men have gone absent in Ugandan families. That task, I think, has to be a continuous task of identifying, using both LC structures, but especially the women councillors as low as LC2 to identify, especially the vulnerable families. And of course, we hope that this exercise won't be riddled with corruption of the LC1 leaders putting in all their relatives.
But yes, Emmanuel Kashaija, corruption aside, there's also the issue that this money is going to be sent to people within the slum areas, the Kampala slum dwellers. We're talking about pregnant mothers, we're talking about single mothers, we're talking about border riders and people within the taxi operating business. What about the people in the rural areas? The argument is that many of these are largely within subsistence agriculture, and this sector largely remained open within the first lockdown and even in the second lockdown. So they envisage a situation whereby people in the rural areas will still have food, whereas the people in the urban centers will be grappling with no food, and that's why they are actually prioritizing the people in the urban centers. But do you think this is a wrong move?
I think I think our government has a lot of capacity gaps. Depending on how deep their current pockets are, they are making those assumptions not based on actual needs, but based on how much they can fund. The assumption that people in rural areas are doing okay is I think being too positive on assumptions, because Romeo, many people in rural areas right now, there are many people in rural areas who don't have their own land, who are even getting food by working on other people's farms, and sometimes crossing even district boundaries. Now, those people, in the eyes of the government will be saying, those ones are okay, they have their gardens, but not everyone in the rural areas these days has their gardens. Some women go across district borders and till other people's lands, work on other people's commercial farms, and those movements have been kind of curtailed. So for me, I think that move is kind of, the assumption is too wide. I think the government needs to do a proper needs assessment, bring in all the structures, bring in the LCs, bring in the local councils, let people submit their needs, and let the government see what it can do, other than assuming that everyone in rural areas is okay, because there are some areas just here in Wakiso, outside Kampala, or parts of Mpigi, where they may consider rural, but those people actually are people who have been working in Kampala and have gone back home. So they are still as vulnerable as those who are in the slums.
At the Forum for Women in Democracy, and also we do have Peter Echweru. He is a program specialist in charge of health and human rights advocacy at the Center for Health, Human Rights and Development. We are talking about how the budget, yes, actually fared on health and other social services right here in Uganda. We do know that the Ministry of Health did get some 1.5 trillion Uganda shillings out of the whooping 7.598 trillion shillings that was given to human capital development. Out of that 1.5 trillion Uganda shillings that was given to the Ministry of Health, 560 will procure vaccines. But that money, according to Kashaija and Peter Echweru, will not go a long way in vaccinating over 21.9 million adults that government is targeting right here in Uganda. We also do know that education did get some 526 billion. We also do know that social development, that is the Ministry of Gender, Labour and Social Development, got some 146 billion, something that Kashaija says is mega funding indeed for that sector. This conversation is largely still in the pipeline. We shall just simply take a short break and return with the same. We'll be right back. Welcome back, and many thanks for staying with us right here in Morning at NTV. My name is Romeo Busik. Of course, the coronavirus pandemic is still rearing its very ugly head unabated. Yes, here we've registered some 73,401 cases of COVID-19. 714 people have actually succumbed. 50,085 have actually recovered from the novel coronavirus disease, meaning 22,000 plus people are grappling actively with the COVID-19 disease, but only 1,099 are distributed in the various health centers within this country, meaning 21,000 of those active cases are people with whom you're living within your community. So you need to be cognizant of that danger, that the person you are with could be carrying or a possible carrier of the novel coronavirus disease. So you need to be protecting yourself by simply wearing a face mask, by simply ensuring social distancing, because we are dealing with an aerosol disease. It is airborne. It is an invisible killer. You cannot see it, but then you can do what others are actually reluctant to do, wearing a face mask, and also ensuring social distancing in that regard. We are having a conversation on how the budget fared on health and other social services. I do have Peter Echweru, a program specialist in charge of health and human rights advocacy at the Center for Health, Human Rights and Development. I also have Mr. Emmanuel Kashaija, the program officer, Gender and Economic Justice at the Forum for Women in Democracy. Gentlemen, very welcome once again to Morning at NTV. Let me go back to you, Peter Echweru, and we talk about whether or not the budget delivered, for example, on the infrastructure needs of the health sector. Peter Echweru.
I haven't picked you, right?
Peter Echweru, we would like to pick your pointers on whether or not this budget actually delivered, for example, on the infrastructure needs of the health sector.
Yeah, in terms of infrastructure needs of the health sector, the budget over the years has emphasized that. We've spent a lot of money building houses for health workers. We've spent a lot of money building, establishing structures at Health Center 2s, Health Center 3s, and upgrading some of those Health Center 2s into Health Center 3s. And this is really commendable. If you look at the performance report for the health sector, you'll notice that that distance from home to health facility over time has now reduced to about 5 kilometers for every Ugandan. That means that you can move 5 kilometers and you are in the nearest either Health Center 2 or Health Center 3 or Health Center 4.
Meaning that means, Peter Chwero, that there's 91% access to health care within a 5 kilometer radius.
Yeah, it is about 75% now of people living within 5 kilometers range of a health facility.
But we were told just 2 weeks ago by Amos Lugolobi, the state minister in charge of planning at the finance ministry, that there is 91% access to healthcare facilities for people within a 5 kilometer radius. 91%.
That could be the latest, because the figure I'm giving you is 2019, 2020. If that has changed, then that is commendable.
Indeed.
And that is really good. And for us, that is really a good sign that we are moving forward. Now, the challenge is in terms of functionality of this health facility.
Indeed.
That is where the problem is. I have heard people who argue that if I go under a tree and meet a doctor and I'm able to get medicine, that is okay. And so the biggest challenge for us now is to deal with the functionality question of the health facility. That's why you find things like medicine. If someone goes to a public health facility, do they have access to medicine? If they go to a public health facility, will they be able to find a doctor? If they go to a public health facility and they need blood, will they find blood? Those are the critical issues that we must now be dealing with as a country. Not just that they are there, but then are they able? And that's, when you look at statistics, that is a challenge. We have failed, especially in terms of staff. If you look at sexual and reproductive health rights and issues of maternal rights,
yes,
you'll actually notice that in terms of staffing, obstetricians are at only 52% of their approved positions. That means that we are operating at almost half of the obstetricians we need. If you look at medicine, we do not have the necessary medicines that we have at those health facilities to be able to serve these people. And that's why when you look at the ministry's own report on the performance of the health sector, it will indicate to you that the public confidence rate in public health facilities has actually dropped from 46% to now 25%. Remember that the commitment of the Ministry of Health was to raise confidence to about 75% by this time. Unfortunately, as every year progresses, the confidence rates in public health facilities is going down. And that is confirmed by the fact that Ugandans are spending a lot of money in private health facilities.
Now, Emmanuel, also speak on the fact that our health workers within the country have also started to die because they have meager resources to actually execute their duties. In Hoima, over 20 health workers have actually succumbed to COVID-19.
True. And you see, when we talk about resources for health, it cuts across all parts of the health sector, including healthcare.
Indeed.
You've heard of consistent strikes by interns. You've heard of consistent complaints by health workers about salaries. This is a big issue. And unless we are able to provide process to ensure that we are able to recruit, we are able to ensure that we protect our health workers, we are able to ensure that they are motivated to do their work, we will continue to have a problem where you go to a health facility, a doctor is not there because they have run to their private facility to make additional money. So it is a big challenge, even in terms of creating a conducive working environment for health workers, to motivate them, to enable them stay at a health facility for longer. We have a high attrition rate. The Ministry of Health is losing staff at a very high rate. While we anticipated that by this time we would have 80% of approved positions filled, you will notice that we are actually regressing. In 2019-2020, we moved backwards instead of moving forward. We are losing more staff and we are not able to retain them. Their staff were being catered for by international organizations in the health sector. The arrangement was that the government would take on some of this staff. Unfortunately, in this current budget that we've passed, we have a deficit of about 12 billion to cater for this stuff. And that means that it remains an unfunded priority because government did not provide resources. So we'll see most of this stuff again drop out of the health system and go into the private sector. So we really have challenges in terms of functionality. In terms of accessibility, we have made significant progress. The challenge now is how do we ensure that the people who go to health
All right.
facilities are able to get the services that they deserve to get in those facilities.
Great
That is what
insights.
the budget must now be thinking about.
Well, great insights by Peter Echwero. He is a program specialist in charge of health and human rights advocacy at the Center for Health, Human Rights and Development. We also have Emmanuel Kashaija. He is a program officer, gender and economic justice at the Forum for Women in Democracy. Emmanuel, we are in a pandemic. People are grappling left, right and center, like Peter Echwero did intimate in his submission. Yes, even the health workers are grappling. But what about members of the community? How can they ensure that they continue making a living in the midst of this pandemic? How do we ensure that continuity of life?
Thank you, Romeo. Before I jump to the community members, I just wanted to emphasize on one point which Peter mentioned. The issue of, for example, at Forum for Women Democracy, we are very concerned about the issues of maternal health. Now, Peter said accessibility is there. But indeed, as he was saying, the functionality of these centers is very, very worrying. The international standards recommend that a midwife should cater for at least a maximum of 1,000 people in terms of population. But in Uganda, we are still having a ratio of 1 midwife for every 5,000 people or women. That means that the midwives are worn out, and that's why you see that Uganda's maternal deaths are not reducing. We are still having 16 women die per day giving birth, partly because there are either lack of midwives and doctors, but also because even the midwife who's there is worn out. When a midwife is forced to work a 24-hour shift, most likely she will make some mistakes. Now, moving on to the community members and how they can better be facilitated to earn a living while adhering to the SOPs. I think I am commending the government in at least keeping the food markets open, because majority of women either work in these food markets or supply these food markets. So that's one area where we commend government for keeping food markets going. But we also urge the government to look into the possible human rights abuses in these places they have left open. For example, the food markets. I think from the first lockdown we had so many stories of women being raped in the markets, because while the president said the women should sleep in the markets, adequate protection wasn't given for these markets. And I think a number of rape cases came through in the first lockdown of women being raped while sleeping in the markets. But also, I think it is the curfew being set at 7 p.m. for me is a bit too restrictive, because if the curfew, for example, was at 8 p.m., it would enable these women to go back home while also making some money for their families. Because besides the cases of rape, we have also had cases of families breaking up because of while on one side the president is praising these women as heroes for sleeping in the markets. We have heard of at least five cases in the last few months where the women went home and the husbands had replaced them with new wives. They said, for you to stay in the market. So to ensure family integrity, I think I would have preferred for the curfew to be at around 8 p.m. so that these women can work up to around 6 p.m. and can go back to their homes. so that both the financial standing is protected, but also the family integrity is protected, because you can't tell a woman in the market to sleep in the market for 42 days while the husband and the children are at home. It is practically impossible. They will either break the rules and be caught up and be caught by the police, or they will leave their market and miss out on making money.
Children, but what about the customers? I mean, she's sleeping at the market, but then the customers have nowhere to reach that person to buy their produce and so forth. It seems like even the market vendors are going to find this situation very, very futile.
Yeah, that's very true, Romeo. And I think in the first lockdown, that's when I think I had some sharp disagreements with some government officials who are saying everything in the market was okay because the food markets were open. But some of these, can you hear me?
Go ahead.
Yes, the government officials who are saying the food markets are open, but for example, who are the biggest customers of the food markets? Besides homes, I think hotels are the biggest customers of food markets because they purchase in big quantities. But if hotels are closed or people can't go to hotels, it means the price of commodities in the food markets are going to go low.
Yes.
Perishable.
Go ahead.
Perishable food items are going to go bad, and so when the government is considering vulnerable persons, I think let them not forget these market women and think that they are making money, because the amount of money they are making in this period drastically reduces because the people who are supposed to reach them do not reach them, and the biggest customers, who are the hotels, are not working. But also I think that's where the government needs to give some backing for local startups like Chikubo Online, startups like I think there's a startup called the Market Garden app, where and to give support to these technology solutions, where customers can order food items from home and ensure efficient delivery, because where we are heading in the next 42 days, or now remaining 39 days, very few people are going to access the market for fresh food. And even people still prefer dry rations during periods of lockdown. So
let's also bring in Peter Echuero, a program specialist in charge of health and human rights advocacy at the Center for Health, Human Rights and Development. Peter Echuero, let's talk about another pertinent issue, the fact that even before this pandemic, we were dealing with meager funding to the health sector and other social sectors. So don't you think this government has learned nothing, even from the onset of this pandemic? Because we are even talking about only 1.5 trillion shillings being conveyed to the health ministry, and only 560 going to education, and only 146 going to social development. Don't you think government has learned nothing, and why? In your opinion?
Well, I think the COVID pandemic is an equalizing factor, and I hope that this will provide us with an opportunity to learn, but also to help prioritize health sector funding. You see, the greatest challenge that this country has is that a lot of decision makers do not actually utilize these public health facilities. They either have health insurance, or when they fall sick, they go out of the country. But with this COVID, it is evident that public officials, those in the corporate world, have all enjoyed the benefits of the public health facilities. The airport is locked, so we don't have those who can fly out. So you find yourself at Mulago or any other public health facility. So I think this should provide an opportunity for us to rethink health sector and replan for it, so that it will serve us in future when we get into a pandemic like this again. You go to a health facility and you know that you can be able to resources. And the same is true about education. A lot of public officials don't have their children in public schools. So they do not have capacity to understand what exactly goes on in these health facilities. Now that we have public officials who have been able to interact, who have come face to face with the challenge of health sector delivery in this country, I hope when these matters go to Parliament, when it comes for discussion at the executive, they will be prioritized so that we see more resources getting allocated. For me, the question is not about absence of resources in this country.
All right, thank you very much, Peter Etweru. He is a program specialist in charge of health and human rights advocacy at the Center for Health, Human Rights and Development. Emmanuel Kashaija, he is the program officer, gender and economic justice at the Forum for Women in Democracy. Let's talk about unfair pricing by the private healthcare facilities. Emmanuel, what do you say to them? They are hiking prices when it comes to the cost of healthcare within the private facilities. What do you have to say to them?
I think, Romeo, as Peter has said, certain situations such as this pandemic and lockdown only bring out the symptoms that have been hiding for some time. When you haven't paid attention to the public health care for some time, then when such a pandemic hits, I think it only exposes what has been in the background. I think we have all seen the case, without mentioning names, of someone recently who spent 10 days in intensive care, a young lady, and had a bill of over 120 million Ugandan shillings. That was, first of all, of course, you ask yourself, what medication or care costs that much?
Because oxygen is going for 800,000, one tank.
Still, her average cost would come to around 12 million per day. Very unrealistic. But you see, as I was saying, those are the symptoms of giving little attention to the public health care, because right now the private health care is overwhelmed, and they are reaping, and that's sometimes when you have a private sector-led economy, you are likely to suffer those consequences because people can't go to the private facilities, because you find an area like Mbara Referral Hospital, which is caters for almost Mbara, Isijo, and everywhere, only has about 10 ICU beds or less. So and if COVID is infecting maybe 50 people per day who need the ICU in that area, then they'll go private. But I think for me, the best would be for the government to come out and negotiate with these private institutions and provide some subsidies, because citizens are a responsibility of the government, especially when you have taken away the ability of citizens to make money. But secondly, a pandemic is a collective responsibility. So we can't let citizens face the brunt alone. Government needs to step in. Government needs to negotiate, because they can't force, because these are private entities. But they need to negotiate and see where they can subsidize for these private hospitals. Can they subsidize oxygen? Can they subsidize PPEs? And this is especially worrying, especially like for in the case of, for example, the lady I just gave an example without mentioning names. We all know that, for example, in Uganda, women are still the face of poverty.
All right.
And so when they're faced with such bills, maybe people just, I think, private hospitals just have to take the bodies and confiscate them, but some people won't be able to pay those bills. They're too high.
Indeed. Thank you very much, Emmanuel Kasai. Of course, he says women will be battered the most. We do know that 1.8 million women who are in the trade business did not go back to pre-pandemic levels of economic activity, and that's what we are saying until 2023. So the effects of this pandemic are going to be continuous, not only in 2020, 2021, 2022, but up to 2023. 1.8 million traders will be out of work in that regard. They will not go back to pre-pandemic economic levels. Let me also bring in Peter Etweru. Let's talk about recommendations that government should be focusing on in a minute or two. What are you asking government to do moving forward? In a minute. Peter Ichweru, what are you asking government to do moving forward? All right. All right, I'm afraid we've lost Peter in that regard. And Emmanuel. Okay, Peter, what are you asking government to do?
I think what is very important for us as a country now is to look to the future, to begin to think about where do we want to be in terms of health sector delivery. When we look at the number of mothers that we lose every year, when we look at the people who are unable to access health service delivery every year, where is it that we want to go? How are we going to stand as a country in case we get the next pandemic in this country? So it is important that we begin as a country to progressively move towards increasing health sector budget. We cannot say that we want 15% in the next financial year, but for a country that is planning for its population, it must begin to think about taking steps forward, having increase in the budget over time so that we achieve this universal health coverage. That is our dream. The NRA manifesto is very clear on its commitments towards improving health. It had made commitments about having 100% of staff positions filled. It had talked about moving towards 60% universal health coverage. We want to see all the things actualized in terms of resources, and we need to steps improve functionality of our health system, because when we are hit by a pandemic like this, then certainly that strong health system will come to our rescue. Thank you very much.
At the Center for Health, Human Rights and Development, we also did have Emmanuel Kashaija, a program officer for gender and economic justice at the Forum for Women in Democracy. We were largely focusing on how the budget fared on health and other social sectors in that regard. We also did have Brian Chida, who was talking about the United Nations Day for the United Nations Public Service Day, which was designated in 2003 to celebrate the virtue and the value of public service.